Dr. Manish and Sayani sir. Good evening, good afternoon, and good morning. This is the 1446th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. NAVEED Awan. Let us begin the session with thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic law, and we have 3 sessions every day, the 7 to 8, 8:30 to 9:30, the international session in English, and 9:30 to 10:30, the local language session in Malayalam. Today, we have a guest from Pakistan, Dr. NAVEED IQBAL AWAN. Doctor has completed DHMS and then MSc Applied Psychology and additional clinical psychology, as well as MSc Chemistry. That means so much of post-graduation with his hand, and is a doctor who is practicing in a beautiful way, has shared a lot of cases in our forum, and is a follower of Dr. Saigal's School of Homeopathy, and is a wonderful person who always shared his a rubric a day in international platforms, and such a nice person, such a person who has so much intense knowledge in how, particularly in repertory and the mind study also. He is a psychologist, is a relationship therapist, homeopathy consultant, international mentor, member of Psychological Association of Pakistan, national and international forum, as well as Dr. NAVEED Awan has successfully treated over thousands of patients in career spanning over many years, and he has presented many cure cases on international platform. He has a vast experience of curing incurable diseases like diabetes, allergies, depression, arthritis, hypothyroidism, gout, aplastic anemia, surgical cases like kidney stones, uterine fibroids, ovarian cysts, warts, tumors, enlarged prostate, behavioral abnormalities, phobias, disobedience, abusiveness, uh, so thumb sucking in children, epilepsy, etc. He has completed his DHMS from Rawalpindi Homeopathic Medical College, and today Doctor will be discussing about a case of management of depression disorder with homeopathy. That is a very, very good subject. So we proudly welcome Dr. NAVEED Awan to this stage. Please wait, yes, sir. I can make you co-host, and then you can begin. 1 minute. Oh, okay. You are co-host now.
Dinesh and all the respectable members of the IFPH. Good evening to all. Yes, screen is visible.
Yes, yes, yes. It is visible now. Okay,
Okay,
everything fine.
okay. So depression disorder with the homeopathy. So first we see what is the basic difference between the depression, anxiety. So first we discuss the depression are daily serious emotional and physical problems. Depression is not just a temporary feeling of sadness or the blues. It is a serious condition that can significantly impact a person's quality of the life. So causes and the risk factors result from the complex interplay of the various factors like biological factors that include the neurotransmitter imbalances such as the serotonin, dopamine, and the norepinephrine, genetic predisposition, hormonal changes, and the medical conditions can contribute to depressions. Psychological factors, personality traits like the low self-esteem, trauma, and chronic stress can increase the risk of developing depression. Environmental factors, life events such as the death of loved ones, financial problems, or the relationship issues can trigger the depressive episodes. So these are the symptoms. The symptoms of the depression can vary slightly depending on the types and can range from the mild to severe. In general, symptom includes low energy or hopeless, thoughts of the and difficult concentration are in making decisions. So depression disorder, anxiety, depression, and the worry. and the lack of interest or pleasure in most activities. It affects how a person feel, think, and handle daily activities. Anxiety is a mental health condition characterized by excessive, persistent worry or fear about everyday situation. It often involves physical symptoms like a racing heart, sweating, or trembling. Key features, persistent worry or fear, often about the future, restless or feeling on the edge, difficult concentration, muscle tension. These are the key features of anxiety. So worry refers to specific, often temporary concern about the potential problem or threats. It's a common experience and can be considered a normal response to stress. Key features, specific concern about the potential problem. For example, financial issues, health, relationships, typically focus on the future events, can be issues are through the problems. So these are the difference between three, how it is solved with the help of the homeopathy.
Sorry, doctor, we could not hear properly. I think some net problem is there.
Yes, there is some network problem with the Dr. Naveed Awan. Let's wait for the doctor. And today's subject is a big one, a good one also. Let us see.
Sorry, some net issue, I think.
There was some little bit of
Nowadays it's going
Yes.
here.
Yes, there was
Okay.
some. Now it is. Now
just
we
I
can.
can. Okay, continue. I see.
Please share. Okay.
Okay. So most of the such cases which are the incurable in other way of treatments, and they are only just palliating such cases like depression disorders, schizophrenia, or some like others, insomnia, etc. These they are only just palliating. But if you select the right medicine here in the homeopathy, you can cure the patient completely. So today such case is also the example of such case. So we move with this case. Observation, 55 years female patient was accompanied by her husband, wearing colorful dress according to her personality. She put her hand to head while narrating complaints. See to me just like this. As I ask her, what's your problem? What's your issue? She just take her hand to head like this and narrating her symptoms like see like this. And throughout the whole case, she just put her hand to head while narrating the symptoms or complaints. So keep in mind this observation of the observatory rubrics. So complaints, stomach ulcer, insomnia, general body pains, major depression disorders. Patient complained that I have suffering from the stomach problems, severe headache, and the body pains. I cannot take anything except dry bread, chapati. Meat, rice, or vegetables do not suit me. I am suffering from these issues for 15 to 20 years. Actually, at that time, I have infertility issue, and I think due to excessive use of medicine from numerous gynecologists, I have started experiencing stomach issues. Nevertheless, my infertility issue has been resolved, but stomach got disturbed. I experienced so much severe headache that I cannot close my eyes. My whole body swell up and doctor diagnosed stomach ulcer. Normally, I take the Panadol in severe headache. My husband has been insisting me to consult a doctor, but I told him that I will not resort to allopathic because my condition became worse after using allopathic medicines. Homeopathy suit me, so I came to you. Patient further narrate her symptoms that I don't fear of anything, but I take tension. I feel that I take tension for nothing. I think I exaggerate even small issues, and make them big problems in my mind. I cannot see others in pain or difficulty. I cannot control myself from the weeping after seeing others in the pain. I have everything in my life. I am fully contented, but cannot come out of taking the tension. Sorry. So my parents were severe ill in my childhood. I would start weeping when I see them in pain. They would start laughing, seeing me weeping, and say, "What happened to you?" I respond that you are in a great pain, so I am weeping. How much you are in pain? When I see anyone in the pain or difficulty, I start weeping. My mother-in-law got leg fracture, and now she is much better. But when I see her, I start weeping. Even my child, I feel any pain or sitting quiet any time, I feel the sympathy for him and start weeping. Now it became my nature that I cannot see anyone in the pain. Although I can do nothing for them, but I cannot control my tears. Maybe they are not feeling any pain, but I am very sensitive. So when I have severe pain, I mean headache, I take the rest and take the Panadol tablet. I do domestic chores myself, remain mild, no change in temperament. I take more tension of others than myself. This was the case. So analysis of case, I use the mind method. Repertory, synthesis, Murphy, and complete is used. I take the rubrics from there. So going through whole case, this lady is very sensitive in the nature. So what is the important in the case? She takes tension and cannot see other in the pain. And what she do? She start weeping, seeing others in the pain. That is very prominent, and mostly the patient told me about this, that she is so much sensitive that she start weeping, seeing the others in the pain. So very beautiful rubric here in repertories. Mind weeping, heart seeing others. That is single carcinosin in synthesis repertory and complete repertory. So very beautiful rubric, and I take this rubric and the case was solved. But I moved to other rubrics too, to explore more the case and to present more in a beautiful to you. So what she did when she came to me and narrate her symptoms or complaints. By narrating her symptoms or complaints, she put her hand to the head. That is, see this. So here the rubric is gesture make hand involuntary motion of head to. There are 8 medicine: arsenic, calcareous, carsi, phosphorus, plumbum, scandium, stramonium, and veritum. These are the 8 medicine. And this rubric was taken from the synthesis repertory, and it is also in the complete repertory. Then next rubric is she wears colorful dress which is according to her personality. Although she is 55 years, she was wearing very colorful dress. Rubric is tasteful. And there are 4 medicine: Karsi, Dalkamara, Kalisal, and Vanilla. So medicine is carcinosin, and I gave her in 200 potency 3 doses alternate days. So follow up after 1 week. She was much better. Now tension release, sleep normal, pain normal. After 15 days, start eating, no abdominal pain and headache. So I advise, if your symptoms get worse, then repeat 1 dose, but till now 2 months pass and no repetition. This was the case. I share her video here, but it is the case of a lady, so it is very sensitive. So I'm sorry, I cannot share his video to you, but that is the case. So in the whole scenario, you see, what is the important while solving such cases? You can't take the normal routine rubrics. normal routine symptoms. You pick the COVID symptoms. What the patient do when at extreme level. So here, what she do? She start weeping. She cannot see others in the pain. That is at the extreme level what she does. So that is the important. Normally what she is doing, like I have written here, that she take the rest, or that I already mentioned that she told that that medicine which I was taken of the infertility medicine, that medicine poisoned me, but I didn't take here the delusion poisoned by the medicine. I didn't take any rubric from that, because she said that she experiences it from the childhood. Why she taken the medicine of infertility from 15 to 20 years back. So what was the important at extreme level? That she is very much sensitive. She cannot see others in the pain. So that is the case. Now we move to some other glimpse of the carcinosinum. So it is prepared from the cancerous breast tissue. It represents the very center of the cancer miasm, which falls between the miasmocytosis and syphilis. The main feeling amongst the remedies and person of cancer miasm is that one's survival depends upon performing the task, which one feels incapable of performing. There is a need to be something that is almost beyond one's capacity. The patients stretch themselves to the utmost in the hope of success, because to them, failure means death and destruction. This miasm therefore has the psychotic flexity as well as the destructive dimensions of the syphilis. Carcinosinum people often have the history of taking on too much at the young age, having too much expectation placed on them, too strict parental control. Remember here, carcinosin have three things common: prolonged history of domination, prolonged history of anxiety, and prolonged history of fear. These three things are very common in the carcinosin. So when you are going through such patients, see if a patient that I felt anxiety or I feel depressed 2 or 3 days, no, 2 or 3 days, no, prolonged, and prolonged mean more than 5, 6, 7, or 8 years. So carcinosin has prolonged history of anxiety, prolonged history of domination, and prolonged history of fear. Sorry. So they try to live up to these expectations and make a tremendous effort to perform the exceedingly well. They set for themselves high standard or goals that are near impossible to achieve, and drive themselves to try and accomplish them in that sense. They reach out for perfection and almost finish themselves in doing so. So why they are so much perfect? What is the reason? If we see here that what is the perfectionist? Who are the perfectionists? These patients have tendency to set the extremely high standard for themselves and others, striving for flawlessness in everything they do. They often have a strong desire for order, control, and precision, and can become deeply concerned with avoiding the mistakes. They are perfectionists. They are fastidious in work. They have fear of career, that if we are not perfection, if we do not show any perfection, we can lose our job. We can lose our career. So they are perfectionists. Secondly, in the childhood, their parent expectation is very high. They got their symptoms worse. They got their disease due to the parents' high expectation. Like a child is weak in the study, but the parents want that their child become the doctor or engineer. They expect the high result, high marks from the child. So due to the high expectation influencing of the others, they got disease. They got the ailments. So carcinosin people often have a history of taking on too much at the young age, having too many expectations placed on them, too strict parental control. They try up to live up to these expectations, make a tremendous effort to perform exceedingly well. They set for themselves high standard or goals that are near impossible to achieve and try themselves to try and accomplish them. In this sense, they reach out to the perfection, almost finish themselves in doing so. So next first rubric is addicted tendency to become. They become easily addicted. So to understand what is the meaning of addiction. When you become in control of something else, when you got tendency to involve in some other things. So what is his addiction? His addiction to delusion martyra. She say delusion martyra. I have to do all the work. She is ambitious. She is passionate. She have tendency to caress others. She want to please others because she have the longing, good opinion from the others. So all she do to the others. So the first rubric is how she got the ailments. Ailments from abuse after being sexually raped. Ailments from abuse after being violence from children. Ailments from abuse after being indignation with. Ailments from anxiety prolonged from. And ailments from expectation of parents too high. Ailments from domination long time for. Ailments from punishment children. So I already mentioned that the carcinosin have the prolonged history of domination, a prolonged history of the anxiety, or prolonged history of the fear. So that is the cause of ailments in them. Then we move to next. Excitement weather, windy and stormy weather. They like the stormy weather. They become the cheerful when they see stormy or windy weather. They are exclusive too. So what is meant by exclusive? They show them that what they are, and they show through their actions, through their cleanness, through their you can see here by their body expression, they show that they are exclusive. And what they do while in the exclusive too, they wear the colorful dress. They are tasteful in their nature, they are tasteful in their taste, they are tasteful in their expression, and they are polite. So fastidious disease in, what is meant by the fastidious disease in? It is very, it contains only 2 or 3 medicine, fastidious disease in. Yes, so yes, there are 2 medicine, carcinosin and peppermint. These patients are meticulous, are excessively attentive to details regarding their health and any potential illness they may have or encounter. They might be overly cautious or concerned about the possibility of contracting disease, and they may take the extensive measures to prevent the illness or to manage their health carefully. So what they do if fastidious in the disease, they meticulously follow the hygiene protocols, regularly sanitize their environment, and strictly adhere to the vaccination schedules to minimize their risk of infection. They might also be very proactive in seeking medical advice or getting regular checkups, even for the minor symptoms, to ensure early detection and the treatment of any potential illness. Why they are fastidious disease in? Because they have fear of cancer. They are despair about their health. Fear AIDS of, fear contagion, fear disease of impending, incurable of being, fear infection of, fear medicine unable to bear any kind of being, fear recover he will not, and fear suffering. So they are very fastidious. Remember, when you apply the rubrics, there is reason behind this. Always there is a reason. Like this patient is very fastidious in disease. So why he is fastidious? Because I mentioned here that they have some apprehension in his mind, like fear anorexia, fear AIDS, fear contagion, fear infection, fear suffering, fear recovery he will not. Therefore, he is so much fastidious. So first rubric was addictive easily. So what type of the addiction in carcinosin have? Affection, yearning for affection. They need the affection. They need love. They need kindness. Because they feel that they have lack of affection. Actually, they were neglected by their father. At that time, they don't got the love. They don't got the affection from their parents. So they are missing that. So these patients have feel deep, often intense desire to receive love, care, attention, and emotional connection from others. This longing can manifest in the various ways and can be directed toward the different types of the relationship, such as romantic partners, family members, or the friends. Such as a romantic context, persons might constantly check their phones for messages from their partners, feeling anxious or disappointed if they do not receive a text or call from his life partner or his girlfriend. So they want to be near with others and feel incomplete or anxious when not receiving the attention or affection from the specific people. They seek physical closeness, have emotional dependency, and have behavioral changes, and need for the affection is not fulfilled. So this patient need the affections from the others because the lack of the affections. Similarly, next we move, fear frogs off. Remember, only single carcinosin is there. Fear frogs off. So if you have a patient in your clinic and that patient and the rates are symptom that doctor, I have fear of frogs. So only one medicine is there, carcinosin. Carcinosin is very concerned about the health of loved ones. Fear health, loved ones about the health of. Why they are so much concerned about the health of loved ones? Because they have the previous history. Ailments from death of loved one, death one after the another. That is the rubric in the Murphy repertories, and there are 4 medicine there. Carcinosin, natramare, and 2 other medicine are there. So they are very concerned. Fear humiliated of being, fear hurt of being emotionally, fear medicine unable to take, and fear pain of the pain unbearable that the pain will become. Normally, when the patient come to you and they say, doctor, I have severe pain in my headache, or I have severe pain in my body, I cannot bear. So when you ask them, what is the apprehension regarding the pain in your mind? He or she say, doctor, this pain will become unbearable. So there are only 2 medicine, carcinosin and ilium sipa. So that is the cure symptoms you can pick from the patient. When patient complain that doctor, I have the fear of this pain, it will become unbearable. I cannot control, I cannot bear this pain. So only there are 2 medicine there. So move to some other glimpse of the carcinosin. Activity, desired activity alternating with lassitude. When a patient say that I want to do work, I want to do any activity, but due to weakness, due to laziness, I cannot do work. You can apply this rubric. There are 10 medicine, agaricus, aloes, oramet, calcareous silicate, carcinosin, chocolate, falco, ginkgo, heroin, cola, medorinium, and positron. These medicine fall in this rubric. When a patient say that I want to do work, but due to weakness, due to laziness, I cannot do. So these patients experience periods of the high energy and motivation, wanting to be active and engage in the various activities, followed by the phases of extreme fatigue, lethargy, and a lack of energy or motivation. This pattern can be seen in several contexts, including psychological conditions, lifestyle, or responses to external stressors. Like you can see that such as in a bipolar disorder, an individual experience the manic episodes where they have an elevated mood, high energy levels, and a strong desire to engage in the numerous activities. Then alternate the depressive episodes, characterized by the profound lassitude, where they feel overwhelming, tired, unmotivated, and uninterrupted in the activities which they usually enjoy. Remember, carcinomas have bipolar disorders. So what is meant by bipolar disorder? At what stage they are at the manic state? Mania. At what stage they are mania? And the other stage, they are the depressive disorder. Mean they have extremely energyful. They have extreme motivation to do any work, but at the other side they are depressive. They lack the energy. So it is called the bipolar disorder, and these bipolar disorders raise after when they abused. Remember, there are only two medicines when you see that the bipolar disorders after abuse after. So one more thing, dwells happy moments dwell on past. Normally, carcinosin mostly remember his happy moments. And there are medicine, carbamylase, carcinosin, dulcamara, gluconine, ruta, scarium, spongia, triticum vulgaris, and vanilla. Please just wait, due to patient disturbance. So these patients have develops happy moments develops on the past. Carbamylase, carcinosin, dulcamara, gluconine, ruta, scarium, spongia, triticum vulgaris, and vanilla. These are the medicine, and they are taken from the synthesis repertory, Murphy complete, and the deGroot repertories. So these patients feels frequently think about the positive experiences from their past. This can provide them the comfort. They wish those moments would return, such as the person who has reminisces about their colleges or school years, which he considered the happiest time of his life. So a patient of I have a patient of hemiplegia who reminisced that the years spent with her son who died and considered the happiest time of his life. He said, I cannot forget the time when we sit together and the way he served me. So these memories bring the joy and comfort to their current life, serving as a mental escape from the present challenges and a way to relieve their positive feelings associated with those times. So these are some glimpses. Again, one more thing, desire, suppressing the desire. Remember, there are always two phases of the medicine. First phase is carcinogen is desireful of the desires. She is very much full of desire. But on the other side, she suppress his desire or her desire. And there are four medicine: carcinosin, Cilicia, Stevia, and Soul. These are the medicine which suppress the desires. So these patients are intentionally holding back their own wishes, needs, or the impulses, often due to the external pressures, social expectation, or the personal reasons. This act of suppressing involves consciously choosing not to pursue or express what they really want, what they truly want, such as a person who is suppressing his desire to become engineer or artist. So despite his interest and the passion for art or engineering, he chooses not to adopt it because of the parental expectation, as parents want to see him as a doctor. You see, mostly fathers are head of the families, do not make the much purchases for their own, although they have also desire for new shoes or expensive cloth, but they fulfill desires of their children and family and suppress their own desires. So already I mentioned that carcinosin got the ailments when their parents have the high expectation from that side, or when the parents have the high domination, like these patients want to become the artist or some other want to another other fields, but their parents want to adopt the field what they want. So here carcinosin also suppress his desire because carcinosin want to please others, pleasing desire to please others, pleasing desire to please his parents. So these are the one phase. Remember, all time carcinosin have not this phase. One time comes when the his mind level, domination level, so much increase that carcinosin become way of life. And then that time he or she becomes contrary to her parents. At first time, he's very obedient, very polite. But then he becomes harsh, disobedience. So there are always the phase in the medicine. I already mentioned that the carcinosin is very conscious about the health of loved ones. So the rubric is mind anticipation relatives for his. There are four medicine: arsenic, calcium, carcinosin, and phosphorus. So these patients have the feeling of eagerly looking forward to our seeing or spending time with the family members. It was positive expectations and excitements about the reuniting with loved ones, such as a person who living abroad or have job placement in another city and could not meet his relatives or families from the long time and now eager to see or spend time with the family members. So this was some phases of the carcinosin. I hope you like it and you enjoyed some phases of the carcinosin. It is a very deep medicine, so it will take a lot of time if we go through the whole remedy. And I will arrange such another session that will be the only contain the study of the carcinosin. So I take the most prominent rubric in front of you. So thank you very much. If you have any queries, you can ask, please.
Thank you, Dr. NAVEED Awan. It's really a very good session indeed. You really show the beauty of carcinosin and how one can study the carcinosin also. What are the most relevant symptoms which will definitely shows the hands towards carcinosin. Well, this is the beauty of homeopathy. And if being a person who well studied in all aspects of material medica as well as this uh, rubric study, and not only that, you know, the mindset of the patient in a beautiful way also, because you have intense knowledge in psychology that also helps you to get to reach the right medicine, right symptoms in the patient. Anyway, it's a big session. It's really a beautiful session, though there was some problem in the network in the early part, but it really doesn't spoiled our day. It really went good thereafter. Anyway, congratulations for such a presentation. And Dr. Remadevi Ambadi has raised the hands, and those who want to participate in discussion can also uh, uh, participate in the discussion. One thing I would like to add about this carcinosin is you just, as you rightly point out, the demanding parents always want the child to be number one, number two. Don't
Yes, yes.
patient always the carcinosin will score in such a way also. When they demand for 90%, then he will score 100%. and that is what is his ability. But because of that, he may develop these kind of symptom, and that is the reason why that patient was treated by you just one dose of the medicine. He's still having no much of problem. Still is improving, and that's what homeopathy is all about. When you choose the right medicine at right time and give the right potency, definitely it will work. I congratulate you for that case presentation also. Yes, yes, Badi madam.
Hello, can you hear me?
Yes,
Can you
yes.
hear?
Yes,
Okay.
yeah, audible. Yes.
Dr. NAVEED AWAN, it was very nice, as Dr. Danesh told. It was very nice session. I think it is the need of the hour, because now we used to treat patients suffering from depression due to the loss of health, wealth, and everything from several IVF, ICSIs, and IUIs and all treatment. But nowadays, it has become more in common people also. Especially after the COVID, they are suffering a lot from all financial, everything, every difficulties. So they become depressed. So we have to give special attention to this mental problem. In infertility treatment, we used to, I and my friend Dr. Chanda used to take 2-3 sessions follow up for counseling them and giving them positive thoughts from us. Then only we can select the correct medicine and give them. First, we have to do counseling, and we have to make up their mind first. Then only we can give medicine.
Exactly.
Now, it's a very nice session, Dr. NAVEED. Please come again and with the different subjects. It was very nice. Thank you, Beta. Thank you.
Thank you, doctor. Thank you, doctor. Thank you very much.
Dr. Raman is asking about the potency.
Yes, 200 potency. I have gave her 200 potency. And for alternate days, only 3 doses were given, and then no repetition till now.
Yes, that's a very good thing indeed, because once the medicine start acting, definitely you can wait, and you can wait until the symptoms until there is no symptoms or new problems arise in the person. Am I right, doctor?
Yeah, you're right. Please.
At what time you expect the patient need some high potency, whether 1 or like so? Whether you need to do all those things in repetition, or whether if for example, if the patient have an exasperation of the symptom, will
Yes.
you give the same potency once again, or will you go for the higher potency, or you wait for some time?
Yeah. So if I just wait for the medicine, because the medicine is going very well and working very well, and then the patient follow up still confirming the right medicine and the right potency. So if patient is not feeling any comfort or any relief from the medicine, then I will move to the high potency. So still the carcinosin is working. So I think that if the patient is suitable and patient is matchable with the medicine, then let it to work. And if not work, then I move to the 1 end. But
Yes.
still it is okay.
Yes, that's the answer I was expecting also. That's exactly what we need to do. If anyone want to have a question or want to say something on carcinosin or anything, you can join with Dr. NAVEED now. Please raise your hand, and Dr. Ramprash sir is there. Okay, you can speak, but some of our Pakistani friends are also there. Please, either you open your video so that we can ask you to unmute, or otherwise you just raise your hand so that we can talk to you.
Thank you, Dr. Dinesh. Congratulations, Dr. NAVEED AWAN sir. Very good. Excellent session. Very good beautiful describe the carcinosin medicine. Long history of fear, long history of anxiety.
Yeah.
Electromagnetic carcinosin. Very nice presentation. Very thanks.
Thank you. Thank you. Thank you.
Depression is the main cause of disease. Emotional, anger depression, fear depression, sad depression, etc. Emotional depression, main cause of disease according to law of homeopathic science. And long depression, chronic diseases, and carcinosin is a very good remedy. Thank you,
Exactly.
sir. Thank you. Thank
Exactly.
you.
Thank you, Dr. Issa, sir. Dr. Raman, do you want to, you can unmute yourself and speak to Dr. Naveed. Yes.
डॉक्टर साहब नमस्कार जी, ये डॉक्टर दिनेश का भी मैं थैंक यू का, डॉक्टर सानी का भी बहुत बहुत थैंक्स करना चाहती हूँ. ही इज द पिलर ऑफ आवर प्रोग्राम वेबिनार सेशन. और एक मैं क्वेश्चन पूछना चाह रही थी, जैसे बाइपोलर डिजीज है, उसमें कार्सिनोसिन इज द ओनली मेडिसिन या अदर मेडिसिन भी यूज कर सकते हैं? आई हैव
No, there-
2-3 पेशेंट्स.
Yeah, there are also other medicine.
हाँ जी.
There are also other medicine. Let me wait, please. I share the what type of the medicine are there.
हाँ जी.
इसमें और बहुत सारी medicines हैं. Let me wait.
नहीं, in bipolar, extreme happy, extreme depressed, extreme active, in the carcinosin is the same. So carcino is suitable in bipolar disease generally.
Dr. Raman, there are 37 medicine in the bipolar disorders, right? So we have to see that how this bipolar disorder raise. What is the reason behind it? And if you see bipolar disorder abuse after, there are only 4 medicines: anacardium, carci, and stepi, and one is Flox. I don't know what this medicine is. Flox, Flux. It is a rare medicine.
सर, अगर मैं पेशेंट को आपका नंबर दूं तो यू कैन ट्रीट पेशेंट लिव इन बॉम्बे.
Okay, yes, why not? Sure. Actually, we have to see that what is the reason behind this bipolar disorders and what the patient is doing at the peak. See here. What is the cure gesture of the carcinosin?
Actually, patient is my relative. Patient is my relative. तो वो पूरा open up नहीं हो पा रहे कि what is the cause behind it.
Okay, you can.
Doctor diagnosed she is a bipolar, और due to bipolar disease parents marriage नहीं करना चाहते कि without inform to the boys, तो बाद में कुछ after marriage कुछ problem आए, तो इस वजह से she is around 32 years, वो मैरिज नहीं कर रहे हैं उसकी वजह से, क्योंकि एक्सट्रीम एवरीथिंग इज एक्सट्रीम.
आप प्लीज आप कंसल्ट कर सकते हैं इस प्रेजेंटेशन के बाद, आप सेपरेटली कंसल्ट कर सकते हैं मेरे नंबर पे.
अच्छा
प्लीज. ओके, सो वन क्विक सिम्टम्स आई एम शेयरिंग यू. Carcinosin, one peculiar and curious gesture: biting the tips of the nails. Biting the tips of the nail like this. Single carcinosin.
अच्छा.
So it is the observatory rubrics. You see the patient, and while the case taking during the narrating the symptoms or complaint, if the patient do like this, so that is the single carcinosin, biting the tips of the nail.
Okay, now it is over.
One more gesture, please. One more. Just making tapping the skull like a patient is doing like this. You see here?
Yes,
like
yes.
This. Tapping the skull. That is also single carcinosin.
Yes, yes, very good.
So these are the peculiar symptoms of the carcinosin, right?
Yes. And now it is up to Dr. Imran Khan. You please unmute yourself and speak. 63. Yes. You can speak now. No. What is your attitude towards carcinosin while treating typical cancerous cases? whether in this if the symptoms are just like what we mentioned here, then we will directly go to
I think time is close. Actually, you remember these are the very complicated cases. Such cases are very complicated. You can't say that in first time you can solve these cases. You have to go through the whole case, and turn by turn you have to see if you have a strong observation, then turn by turn you go on the different remedies, because these cases are very complicated. This patient was in the start. I have given her the aconite. Now you will ask me why I have given her aconite. Because she said, whenever I have a severe headache, I take the Panadol. I take the Panadol. Or someone asks me, take the Disprin. I will take the Disprin. So in the repertory rubric is delusion sheep driving. That is single aconite. Aconite work about 1 week or 10 days or 15 days. But when the patient used the medicine, she was okay. But as the medicine stopped, then again she got the previous symptoms. So I moved to the next remedy, carcinosin. And I take the whole case, reanalysis. And then the carcinosin was selected. So sometime you can't see, you can't say that only one medicine will work properly, or that is the final. In such cases, you have to reanalysis your case. You have to go through your case to select the right medicines. Thank you.
Very good answer indeed. And before closing the time, let me announce for tomorrow's session, and then we will have a photo thanks session from Dr. Ramadevi Ambadi, madam. Tomorrow we will have a session from Dr. Jinesar Eligudu, and Doctor will be talking about a role of homeopathy physician in organ and tissue and body donation. That is the subject to be discussed tomorrow. And now I invite Dr. Ramadevi Ambadi to say a vote of thanks to the session.
Hello, can you hear?
Yes.
Can you hear
Thank
me?
you, Doctor.
Okay. Thank you a lot, Dr. Naveed. On behalf of me as well as IFPH, I convey my thanks to you. Please come again and again. It was very provoking subject, and I just, as I told, it's the need of our. Please come with another subjects like this. Okay, thank you a lot.
Thank you, Doctor. Thank you. Thanks.
Be blessed.
Yes.
Thank you, Dr. Ram. Thank you.
Yes.
So, thanks to all the respectable members, and it is a very good platform to promote the homeopathy. I encourage all the other doctors who are sitting here that they should come here, because it is the time of the need. It is a need time to present yourself. Nowadays, most of the sorry, it will be take a time. I think you are going to include it, but remember, now it is a time. Most of the people are experiences are using the homeopathic medicines. Most of the doctors are successful in their practice, but they are not displaying it on such platform. They should come here. They should come forward to display, to express their presentation here, to express themselves here, so the world can know that how much homeopathy is useful in treating the such diseases which are the incurable in the other sciences, other treatments. So thank you very much to all the members.
Knowledge is the only thing which will be increased by sharing.
Exactly, Dr. Naveed, you are 100% right. This is what we are expecting from the participants also. All of you can present whenever you are ready. You please inform us. We will give you the platform so that we can know what is happening with you and how you handle homeopathy and how how homeopathy works in different situations. Thank you all for such a wonderful session from Dr. Naveed Awan and those who attended the session. And we are really having many presentation expecting from Dr. Naveed and his team from Pakistan. It's really, most of you are presenting the cases as per Saigal's method. Whatever be the situation, we really enjoy every second of your presentation. Thank you, Dr. Naveed, once again.
Thank you. Thank you. Thank you. Thank you so much. Take care, please, all of you. Thanks a lot. Thank you. Bye.
It's over to Dr. Mariama John to moderate the Malayalam session. Thank you.